Hi, how are you? Welcome to this week's episode of our Town Hall series sponsored by Certified Physician Assistant Consulting. My name is Kasey D'Amato. I am president of Certified PA Consulting. I've been a PA since 2003, so quite some time now. And I'm also been a practice manager of a multi-million-dollar practice in Los Angeles, as well as owned multiple other companies, raised capital, sold companies, and everything in between. So now I spend and devote my whole time and career to coaching and consulting for PAs, physicians, NPs to help people really understand business fundamentals that we really weren't taught in medical school, pre-med, you name it, nursing school, all of the above. So I put out a video every single week. I hope that it's helpful for you, that my experience is able to be applied to some aspect of your life and your career and can be helpful along your journey. On this week, we're talking about how to measure productivity and use the data in negotiations. So productivity, what I mean by that, and what we work with a lot, this data point, when we are working privately with our clients one-on-one, and we teach some of this in our negotiation masterclass. Productivity, most of the time we're talking about collections. So actually revenue, not RVUs, but actual revenue that is generated from your efforts. Because as medical professionals, we are service providers. And this is all of us. This is everybody who's billing out for their patient encounters. So you're talking about physicians, PAs, NPs, dentists, therapists. We are all service providers. We are billing out per encounter for that service that we provide to the patient. So in essence, time equals money in our type of profession, in a service type profession. So when we talk about productivity, most of the time we are talking about revenue generated and not so much RVUs, which are relative value units, which can vary from facility to facility. They're not a fixed unit. One RVU does not equal $1 necessarily. In some facilities it might, but it also might not. So when we're talking about productivity, we're talking about actual revenue that's generated. Why is this important? Because when you're negotiating for your salary, the money has to come from someplace. As if you're a service provider, it has to come from the services that you are providing, unless you're working in a very large hospital system, in which case they can take money from one department and move it around to another department. If you're in a large hospital system, there might be a lot of money generating from like ortho or something like that, heavy surgical specialty, and there's less generating from the less surgical specialties, but still we need to compensate those providers. They're really important, hospitalists and infectious disease and things like that. So that's where RVUs can become important, because then the hospital can designate a value to their relative value unit, and they can move around money between specialties and between departments. But I'm not going to talk about RVUs right now. We're just going to talk about straight productivity and what other categories other than revenue and collections can apply. What else do we talk about? We talk about productivity when it comes to negotiations. So some of the other categories that we talk about is collections. If you don't know your collections, by the way, before I get to that, if you don't know your collections, you can estimate. You can look at the number of patients that you see per day and the type of procedures that are most common for you, and you can do some napkin math. We do this all the time with our clients. It can give you a really close, rough estimate. You can look up the Medicare reimbursements in your area, and it's pretty easy to get a pretty close, accurate estimate. Most likely within 10-15%, you can get pretty close of your actual collections. So outside of collections, what else do we look at when we're talking about productivity, and what can be perceived as valuable, and can warrant higher salaries if the facility has the money? If they don't have the money, if it's not coming from your efforts, it's got to be coming from someplace else. So that the key is they have to have the money, but what could be perceived as valuable? So some of the other roles that can be considered highly productive and highly valuable would be leadership. Any kind of leadership. So whether you're taking on some kind of administrative duty, or you're getting involved in a committee or a task force, or overseeing research, there's a lot of money that can be generated with research and grants and things like that. So then that increases your productivity, which then can justify a higher salary. The other thing that you can do, you can help with Patient satisfaction, especially if you're someplace that really values satisfaction reports, how do you improve patient satisfaction? So that can be perceived as really, really valuable, because sometimes some of these private hospitals are raising money, raising outside capital, private equity capital. So when you're raising outside capital, the investors need to see an objective data point. Sometimes they're looking at patient satisfaction as one of the data points they're looking at to consider investing into this facility. What else? Marketing efforts. If you're working in a smaller boutique private practice, and you're really good at social media or something like that, that can be really, really valuable, because now they don't have to go and hire a social media manager. Maybe you can take on that role, and that helps them get word out so that more people know about the facility. That can be really valuable. Even though you might not see the revenue right away from it, it's the building block that builds the reputation for that boutique practice. And it can be what we consider a more productive type of provider or employee, and it can justify a higher salary. So how do you measure your productivity? Look at your collections, number one. If you don't know them, then get some napkin math and do some estimates, a number of patients per day and the average type of procedures that you do, or office visits, whatever it is. You can extrapolate out that math on how much you generate per month and get pretty close. If those are low numbers, like you're in a specialty that doesn't do a lot of procedures, don't worry. If you want to increase your productivity or your perceived productivity, you think about these other things that you can do, which is leadership, management of people, patient satisfaction reports, overseeing how to improve that, marketing efforts, administrative. That's another one. How do you improve processes and protocols? Are there internal hiccups within your facility where people lose time or efficiency, or how can you streamline a little bit more to use less resources? If you can improve processes and protocols, that can also be perceived as very valuable, or AKA increasing productivity. So productivity, yes, most of the time we're talking about actually revenue generated, but sometimes we're talking about how do you increase your value? Or are you already increasing your value beyond your productivity? And if so, is there money in this facility coming from other places? If it's a very small boutique, there may not be a lot more money other than what you're generating with your patient encounter. But if it's a large facility and there's other providers and there's lots of income streams coming in, we have a whole video that we just made on income streams, then there may be opportunity to negotiate around your, quote, productivity, whether that is revenue generated or whether that is value generated. So we just want to touch upon this. We talk about this a lot in our Master the Boss Mindset Negotiation Masterclass. We talk about it a lot in our private client meetings. We work with PAs every single day, helping them with their personal negotiation strategy to understand what their productivity is, what their value is, what the perceived value is. Because if you're doing a lot of social media, but the practice owner or administrator doesn't value that, they don't see any benefit there, then it's not going to be a strong negotiating point. So keep that in mind as well, that if you are doing these things that you believe are increasing your productivity or value, make sure that the practice owner or administrator sees value in that type of productivity, because they may or may not. And we've seen that happen with clients as well. So we coach people through this to make sure that you are putting your effort into the areas that are going to be perceived as the most productive from the practice owner or administrator, because not all of these areas are perceived as productive. In some cases, actually, they can be perceived as a distraction. So I'm mentioning them because they are all options, but they don't all apply to every facility, and not every facility's owner is going to see the same value in each one of these things. So that's really important as well. So make sure, if you're uncertain how to increase your productivity, your value, or understand if what you're doing is perceived as valuable and productive for the practice owners, reach out to us. Check out our other free videos, watch our free webinars. We've got on-demand courses that are super low cost. They qualify for Category 2 CME. And of course, you can work with us one-on-one. Check the links below. There's links to our website, lots of information out there. We'd be honored to work with you. And I hope to see you on next week's Town Hall video.